Okay, the Evercare program is geared to our senior citizens. Evercare is a division of United Health Group, which caters into our geriatric aging population. The dental aspect that I call the Evercare program is how do we get to especially our members' patients that are in long-term care facilities and reduce the amount of acute episodes that we're seeing coming out of these long-term care facilities by maintaining oral health. We've been doing it throughout the country, but with great emphasis on New York and New Jersey. And our Medicare Advantage members in the state of New Jersey now received a home care kit, mechanical toothbrush. They have xylitol substitutes, and where indicated, we'll put them on chlorhexidine gels, chlorhexidine rinses, etc. So it's a change from a disease entity that we try to control in a preventive model versus treating acute care, and then correlating and integrating and collaborating these procedures to have true outcome-based dentistry medicine that is linked. We have found that if we can put our patients, our members, on a preventive program, we can reduce the amount of hospital stays, admissions for chronic obstructive pulmonary disease, aspiration pneumonias. The real connection is in the respiratory pulmonary phase, where we have our long-term care facility members that are basically inhaling bacteria. And this is not a good thing. So the object that is to keep people in a healthy situation, maintaining them in health, measuring outcomes, reducing the vast medical costs by doing simple interceptive dental procedures. Well, Evercare is very simple. Through the United Healthcare website, we offer the program through Medicare Advantage. We offer it through our Medicaid programs, governmental programs, and we are expanding it into commercial. The key to it is having total care, comprehensive care, medical, dental, behavioral health, making changes, and assessing, doing individual assessments, and then establishing a treatment plan that would incorporate not only the medical dental end, but also behavioral health patterns. It's key. It's key. Simple. We'll take the common denominator of good healthcare to me is integration and simplicity. Take the simplest approach. It just doesn't make sense for mom's gums to be bleeding. Okay? That we do not need evidence-based to say this is not a sign of health. Bleeding anywhere else in the body would be catastrophic. In the mouth, we accept it. So we know that we have an inflammatory process going on. We have to treat that inflammatory process. If evidence-based shows that there are systemic links, that's wonderful. Right now, I want to treat the disease, and that's periodontal disease. And the correlation that could exist, even though it's not causal at this stage, between periodontal disease and respiratory, between periodontal disease and the exacerbation or uncontrol of diabetes in long-term care facilities. We want our dentists to be trained not only to work with hygiene, nursing staff, nurse practitioners, physician assistants, physicians, on integrating all of this health care. And what we mean by that is oral hygiene, nutrition, controlling bacteria. Last but not least, what we want is to do, a physician, a dentist, etc., should know that a hemoglobin A1C is the best monitor to control diabetes or even predict the diabetic. This is the change. We have to get away from glucometers, listen to what the American Diabetes Association is saying, get a 3-month readout by checking red blood cells, and come back with a method to maintain health, not to just treat disease.